Did you know that any medicine or supplement you take will pass through your kidneys? And did you know that 1 in every 5 cases of acute kidney failure is due to medications? This is precisely because one of the main functions of the kidneys is to eliminate toxins, waste, and toxic substances circulating in your blood. They also remove excess fluid by filtering the blood to produce urine. Additionally, the kidneys maintain balanced levels of electrolytes, the body's salts, and produce hormones that influence your blood pressure, bones, and blood. If any toxin damages the kidneys, they can fail to perform their job. That's why it's important to know whether the medication you're taking can harm your kidneys. And that's the subject of today's video. The top 10 common types of medicines that can harm your kidneys and what to do to protect them. But before we begin, go ahead and like the video, subscribe to the channel so you don't miss our health tips, and hit the bell icon to receive notifications. And also, share this knowledge with your friends and family. About 850 million people worldwide have some degree of kidney failure, and many don't even know they have it. By sharing, you'll be helping more people, so go ahead and share. Let's go. Some medicines can damage your kidneys even if your creatinine levels are fine, you're urinating well, and you don't have kidney problems. However, if your kidneys are already damaged, these medicines can worsen them further, potentially leading to chronic kidney failure, which might necessitate hemodialysis or even a kidney transplant. It's essential to remember that this content serves purely as information and should never replace the invaluable counsel of healthcare professionals. I list the top 10 worst ones, and the last one is the most problematic for kidneys in practice, so stay tuned until the end. 1. Antibiotics. Various classes of antibiotics can harm your kidneys in different ways. Aminoglycosides, the most toxic, are neomycin, followed by gentamicin and amikacin. Another class, sulfas, like Bactrim, can produce crystals that don't break down and block urine flow. Vancomycin can cause swelling and inflammation in the kidneys, leading to kidney failure. Quinolones like ciprofloxacin can lead to interstitial nephritis. And remember, if you have kidney problems, some antibiotics need to be titrated, and doses should be reduced to avoid further kidney damage. 2. Laxatives. In general, laxatives are safe for most people. Of course, if you become dehydrated, it can harm your kidneys. However, some laxatives prescribed to cleanse the intestines before a colonoscopy, such as sodium phosphate, can harm your kidneys. 3. Antivirals. If you've had herpes simplex or herpes zoster, your doctor may have prescribed acyclovir or valacyclovir. Be aware that they can cause swelling and inflammation in the kidneys and can also lead to the formation of undissolved crystals. This category also includes antiretrovirals for HIV, such as tenofovir and indinavir, which can cause toxicity in renal tubular cells. So, if you have to take these medicines, make sure to stay well hydrated. 4. Fibrates. Fibrates, such as ciprofibrate, fenofibrate, and gemfibrozil, are used for elevated triglyceride levels in patients with some degree of renal dysfunction. This class can worsen kidney injury and should be avoided. 5. Medicines for gastritis and heartburn. A study published in JAMA in 2016 identified that proton pump inhibitors, omeprazole, lansoprazole, esomeprazole, may be linked to kidney damage when used long-term. People who chronically use this type of medication were found to have a 20% to 50% higher risk of chronic kidney disease compared to those who did not use them. While the study doesn't establish a cause and effect relationship, the higher the dose, the greater the risk of kidney issues. 6. Blood pressure medications like ACE inhibitors or ARBs. These include captopril, enalapril, ramipril, ACE inhibitors, and losartan, valsartan, olmesartan, ARBs. These two classes can be both good and bad for the kidneys. How so? They act on the efferent artery, causing vasodilation. So, if you have heart failure, hypertension, or diabetes, they tend to preserve renal function and slow down kidney loss. However, When person is severely dehydrated or has terminal kidney failure, these medicines, which previously acted as a shield for the kidneys, can precipitate hemodialysis and may increase potassium levels. In cases of severely compromised kidneys, it's best for the doctor to discontinue these medications. It's like a falling balloon where the balloonist has to drop sandbags to ascend again. 7. Psychiatric medications. Lithium for bipolar disorder can increase the risk of kidney problems. If blood lithium levels are too high, it can lead to kidney issues. Antipsychotics like quetiapine, olanzapine, and risperidone, especially in elderly patients, appear to double the risk of hospitalization due to acute injury. Of course, if you're taking these medications, do not stop them without consulting your doctor. If they were prescribed, there's no issue. Top 3. The 3 medications that harm the kidneys the most. 8. Diuretics. We cardiologists are champions when it comes to prescribing diuretics. They are beneficial for both hypertension and heart failure. They help your body get rid of excess fluid. However, sometimes they can lead to dehydration, which can be harmful to your kidneys. Examples of diuretics are furosemide Lasix, hydrochlorothiazide, indapamide, and chlorthalidone. 9. Contrast agents. If you're going to have a contrast-enhanced scan, such as a quartz scan, it's better to ensure that your kidney function is good before the procedure. Iodinated contrast agents can induce contrast-induced nephropathy. It's not just quartz scans. Other procedures like angiography, cardiac catheterization, and excretory urography also use iodine, which can be nephrotoxic. However, contrast agents used in MRI scans are generally safe, except in cases of advanced kidney failure. 10. Anti-inflammatory drugs. When we think of medicines that can harm the kidneys, I'm sure you thought of anti-inflammatory drugs, and you're right. Anti-inflammatory drugs like ibuprofen, naproxen, and diclofenac top the list of medications that can cause significant kidney damage due to their widespread use. While these drugs can alleviate joint pain, menstrual pain, and muscular pain, they can reduce blood flow to the kidneys, leading to acute kidney failure and interstitial nephritis, especially if you have existing kidney issues. Prolonged high-dose use, particularly in the presence of kidney problems, can increase the risk of acute kidney failure, sometimes requiring urgent hemodialysis. The risk of kidney damage increases after 3 days of use. The renal disease associated with anti-inflammatory drugs is avoidable. A common question is whether taking aspirin for stroke or heart attack prevention, as aspirin is also an anti-inflammatory, will harm the kidneys. At prophylactic doses 81 to 200 milligrams, even with prolonged use or reduced kidney function, it generally won't harm the kidneys. However, abusing aspirin, taking multiple 500 milligrams doses several times a day for extended periods, can lead to kidney damage, along with the risk of ulcers. What pain relievers are safe for people with kidney disease? Paracetamol, acetaminophen, and dipyrone are considered safe. If an anti-inflammatory is needed, corticosteroids could be considered, although they also carry risks for other conditions such as osteoporosis, increased blood glucose levels, and cataracts. How to prevent kidney damage? Do not take any medication without a prescription from your doctor. This applies to supplements as well. Some supplements like chromium, yohimbine, and creatine can harm a kidney that is already compromised. So exercise extra caution. Avoid dehydration. Stay well hydrated so your kidneys can efficiently eliminate toxins. Dehydration is an own risk factor for kidney failure as it can cause medications to become more concentrated and linger in your body for longer. Avoid consuming alcohol while taking medications, as alcohol leads to dehydration, increases blood pressure, and puts you at a high risk of kidney problems. If you have high blood pressure, make sure to keep it well controlled. Both high and low blood pressure can harm the kidneys. If you have diabetes, it's also crucial to keep your blood sugar levels well controlled to prevent kidney issues. You already have kidney problems. Make regular visits to your nephrologist. Lastly, It's important to remember that individuals with kidney issues should avoid consuming star fruit, whether in juice or fruit form. Star fruit contains a substance called caramboxin that can be neurotoxic if your kidneys cannot excrete it. Ingesting star fruit can lead to intoxication, causing symptoms like vomiting, uncontrollable hiccups, weakness, restlessness, seizures, and even death. Therefore, it's best to avoid star fruit altogether. Continue here with us for more health and well-being content. Click on one of the videos that's appearing on your screen, and click to subscribe for more health tips. Stay healthy, stay happy.